In today's video, we explore 25 emergency room nurse interview questions and answers. Don't forget to customize these answers to highlight your unique qualifications and experiences. Here's a bonus tip: research the company and review the job description so you can incorporate key skills relevant to the job role in your answers. Question number 1. Tell me about yourself and your nursing journey. This question is meant to get a sense of your background, motivation, and personality. Keep your answer professional and focused on your nursing path rather than personal details. A good approach is to structure your response in 3 parts: your background and education, your experience or clinical exposure, and your passion or reason for choosing emergency nursing. End your answer by connecting your journey to why you're excited about the role you're applying for. Here's a sample answer for someone who has prior experience working as an nurse. I would describe myself as a dedicated and adaptable nurse with a strong commitment to patient-centered care. I began my nursing career 5 years ago after earning my BSN, and I was immediately drawn to the fast-paced, unpredictable environment of the emergency department. Over the years, I've developed strong triage skills, the ability to stay calm under pressure, and a deep understanding of how teamwork drives positive patient outcomes. In my current role, I manage critical trauma cases, perform rapid assessments, and communicate effectively with multidisciplinary teams to stabilize patients quickly. I take pride in remaining composed even during chaotic situations and ensuring that every patient, no matter their condition, receives compassion and dignity. I'm now looking to join an team that values continuous growth, collaboration, and innovation in patient care, and I believe this position aligns perfectly with my experience and long-term professional goals. Now here's a sample answer for someone who has no prior experience working as an nurse. I'm a recent nursing graduate with strong clinical training and a deep interest in emergency care. During my rotations, I found myself most engaged in high-acuity settings where quick thinking and collaboration were essential. I learned how vital effective communication, triage awareness, and calm decision-making are when patients arrive in critical condition. While I haven't worked as an nurse yet, I've gained valuable exposure assisting with assessments, monitoring vitals, and supporting rapid response teams during my hospital placements. I'm highly motivated to grow in this specialty because I thrive in dynamic environments where every second counts. I see emergency nursing as a field where I can make an immediate difference and continuously learn from experienced mentors. Joining your team would allow me to apply my foundation in patient care, expand my clinical skills, and contribute to a department that truly impacts lives every day. Question number 2. Why do you want to work in the emergency department? This question reveals your motivation for choosing emergency nursing and helps interviewers assess whether you understand the challenges of the role. Focus on the fast-paced environment, teamwork, and your ability to stay calm under pressure. Share what excites you about the such as critical thinking, variety of cases, or helping patients in urgent situations. End by connecting your passion to the hospital or facility you're interviewing with, showing that your interest is genuine and aligned with their values. I've always been drawn to the unpredictable and high-stakes environment of the emergency department because it brings out the best in my critical thinking and teamwork skills. During my years in acute care, I realized how much I thrive when every second counts, whether that's stabilizing a trauma patient or quickly identifying life-threatening symptoms. The demands strong communication, collaboration, and quick judgment, all of which I've developed through years of experience in multidisciplinary teams. What truly motivates me is knowing that in emergency nursing, you can make a life-changing impact in just minutes. I also appreciate how every shift offers opportunities to learn something new, from handling diverse cases to using advanced technology and protocols. Joining your emergency department would allow me to contribute my skills while continuing to grow in a setting that challenges me, rewards quick thinking, and reinforces the true meaning of patient-centered care. Question number 3. What qualities make a successful nurse? Interviewers ask this question to see if you understand what's required to succeed in such a fast-paced and emotionally demanding environment. They're looking for qualities like resilience, adaptability, critical thinking, empathy, and teamwork. Use your answer to highlight traits you personally demonstrate, giving examples when possible. Whether or not you have direct experience, focus on how your personality and professional habits fit the role's intensity and responsibility. I believe successful nurses combine clinical expertise with emotional intelligence and teamwork. In the emergency department, every second matters, and situations can change in an instant. I've learned that strong prioritization skills, clear communication, and the ability to stay calm under pressure are essential. I've often had to switch between assisting with trauma patients, stabilizing cardiac emergencies, and comforting anxious families, all within a single shift. I think adaptability and empathy are just as important as technical skill because patients and families look to us for both reassurance and swift action. I'm also very detail-oriented and take pride in anticipating needs before they arise, whether that means preparing equipment or supporting a fellow nurse. Ultimately, a successful nurse doesn't just handle chaos, they bring order, compassion, and confidence to every patient encounter. Question number 4. Describe your previous emergency or acute care experience. This question helps the interviewer assess how hands-on your background is and how well you've adapted to high acuity environments. If you have experience, describe your specific responsibilities and the types of patients you handled. If you don't, focus on your exposure through clinical rotations or transferable skills from other units. Highlight teamwork, multitasking, and critical thinking. Here's a sample answer for someone who has prior emergency or acute care experience. In my current position as an nurse, I care for a wide range of patients, from trauma and cardiac emergencies to psychiatric crises and pediatric injuries. My responsibilities include triage, intravenous insertions, medication administration, wound care, and assisting with resuscitation efforts. I've become proficient at managing multiple critical patients while ensuring accuracy and compassion in every task. One of the most valuable lessons I've learned is how to maintain composure under intense pressure, staying focused on the patient's needs even when the environment feels chaotic. I work closely with physicians and fellow nurses to ensure smooth communication and timely interventions. This role has strengthened my assessment skills, reinforced my ability to prioritize, and deepened my appreciation for the teamwork required in emergency care. It's an environment that constantly challenges me and reminds me why I chose nursing, to make a difference in moments that truly matter. Now, here's a sample answer for someone who has no prior emergency or acute care experience. Although I haven't worked full-time in an emergency department yet, I gained valuable experience during my acute care and clinical rotations. I assisted with triage assessments, monitored vital signs for trauma and cardiac patients, and observed rapid response procedures. I also had the opportunity to assist in wound dressing changes, administer medications under supervision, and communicate with families in high-stress situations. These experiences taught me the importance of quick thinking, teamwork, and maintaining empathy even in intense circumstances. I discovered that I thrive in environments where I need to adapt quickly and support patients during critical moments. While I'm still early in my career, I've built a strong foundation of skills and an eagerness to continue learning in an setting. I'm confident that my training, combined with my calm demeanor and focus, will allow me to contribute effectively to your emergency team. Question number 5. How do you handle high-stress situations? This question evaluates your emotional stability and problem-solving skills. Nurses face unpredictable high-pressure scenarios, so interviewers want to see that you can stay focused without letting stress impact your performance. A strong answer includes strategies you use to manage stress, like breathing techniques, prioritization, teamwork, and maintaining a patient-first mindset. Working in the has taught me that stress is part of the job, but how you handle it defines your effectiveness as a nurse. When I'm faced with high-stress situations, I focus on what's immediately within my control, staying calm, thinking clearly, and prioritizing care. For example, during a multi-trauma case, I center myself by mentally reviewing the steps I need to take instead of letting the chaos around me become overwhelming. I communicate clearly with the team, delegate tasks when appropriate, and rely on established protocols to maintain structure. I've also learned to debrief after critical events and take short moments during the shift to reset, even if it's just a few deep breaths. Outside of work, I manage stress through exercise and mindfulness, which helps me stay emotionally balanced. I've found that composure and teamwork turn stressful situations into coordinated, successful outcomes for patients. Question number 6. Tell me about a time you manage multiple critical patients at once. This behavioral question tests your ability to prioritize, stay organized, and maintain composure in a high-pressure environment. Use the STAR method: situation, task, action, and result to structure your response. Show that you can assess urgency, delegate tasks, and collaborate effectively with your team. If you don't have experience, describe a similar high-pressure situation from clinical rotations or another healthcare setting where you balanced multiple responsibilities safely. During one particularly intense shift, our received 2 trauma patients and a cardiac arrest within minutes of each other. As the primary nurse for the trauma bay, I quickly assessed my patient, initiated IV access, and coordinated with respiratory therapy while maintaining communication with the charge nurse. I delegated monitoring tasks to another nurse and ensured proper documentation as labs and imaging were ordered. Meanwhile, I assisted briefly in stabilizing the cardiac arrest patient once my own case was under control. Clear communication and teamwork were essential. We all knew our roles and supported one another seamlessly. Despite the chaos, each patient received timely interventions, and both trauma patients were stabilized for transfer to the ICU. That experience reinforced how organization, trust, and teamwork allow us to handle multiple critical cases safely without compromising patient care. Question number 7. Describe a situation. You noticed a patient's condition deteriorating and what you did. This question assesses your clinical judgment and response under pressure. The interviewer wants to know that you can recognize early warning signs and act quickly. Use the STAR method again to describe how you identified the issue, communicated effectively, and followed proper procedures. If you lack real-world experience, describe a simulation or training scenario that highlights your awareness and quick action. Here are 2 different variations you can use to answer this interview question. Let's take a look at the first one. While working in the I once noticed a patient's blood pressure dropping rapidly after receiving IV fluids for dehydration. Although the patient appeared stable moments earlier, their color began to fade and their breathing became shallow. I immediately rechecked vital signs, recognized the sudden change, and called for the attending physician. I quickly increased oxygen flow, stopped the fluid infusion, and prepared the crash cart in case of further decline. The team responded quickly, and after reassessment, the patient was stabilized with medication and close monitoring. That incident reminded me how vital it is to trust your instincts and observe subtle physical changes, not just rely on monitors. Early recognition and clear communication can truly make the difference between stabilization and a critical event. Now here's the second variation. During my clinical training, I cared for a post-operative patient whose condition began to change unexpectedly. I noticed their skin becoming pale and cool, and their respiratory rate increased even though vital signs were within normal limits earlier. I immediately notified my preceptor, rechecked vitals, and assisted in calling for the physician. We discovered the patient was experiencing internal bleeding, and because we acted quickly, the issue was addressed before it became life-threatening. That experience reinforced how important it is to stay observant and speak up, even if you're not certain something is wrong. I learned that quick action, teamwork, and trust in your assessment skills are key to providing safe, effective patient care. Question number 8. How do you prioritize care when there are multiple patients in need? Interviewers want to understand your triage mindset, how you decide which patients require immediate attention. Explain your ability to assess severity, use clinical judgment, and rely on teamwork. Mention clear communication and patient safety as guiding principles. In the emergency department, prioritization is a constant balancing act. I rely on a mix of clinical judgment, triage principles, and situational awareness to make rapid decisions. For example, I always address life-threatening conditions first. Patients with airway, breathing, or circulation issues take priority. Once critical needs are stabilized, I move on to moderate cases like fractures or non-life-threatening wounds. During busy shifts, I also communicate continuously with the charge nurse and team to adjust priorities as conditions change. I document everything clearly and set patient expectations honestly if there's a wait. This organized, transparent approach helps maintain safety while ensuring every patient receives timely and appropriate care. I've learned that prioritization isn't just about speed, it's about staying calm, using judgment, and working together effectively. Question number 9. Tell me about a conflict with a physician or team member and how you resolved it. This question evaluates your interpersonal skills and professionalism. The interviewer wants to know that you can handle disagreements constructively and maintain patient safety as your top priority. Use the STAR method, focusing on communication, respect, and collaboration. Avoid placing blame, show maturity and teamwork instead. During one shift, a physician and I disagreed about a medication order for a patient with low blood pressure. I noticed the order for a vasodilator seemed unusual given the patient's current condition. Instead of ignoring it or confronting the physician abruptly, I approached the situation respectfully by asking for clarification. I shared the latest vitals and my concerns, framing it as wanting to ensure the best outcome for the patient. After reviewing the data together, the physician agreed to adjust the order. The interaction reinforced how open, respectful communication protects patients and strengthens professional relationships. It also reminded me that voicing concerns is part of being a responsible nurse. It's not about challenging authority, but ensuring patient safety. Question number 10. Describe a time you made a mistake in clinical practice and how you handled it. This behavioral question tests accountability, honesty, and your ability to learn from errors. Employers don't expect perfection. They want to see self-awareness and a willingness to grow. Use the STAR method, situation, task, action, result, to explain what happened, what steps you took to correct it, and how it shaped your practice moving forward. During one of my shifts, I realized I had documented a medication administration under the wrong patient chart. As soon as I noticed the mistake, I informed my supervising nurse, corrected the entry according to policy, and filed an incident report to ensure transparency. I also spoke with my preceptor about how to prevent similar mix-ups, and we reviewed strategies like verifying patient identifiers and pausing before documentation. The experience taught me the importance of slowing down and staying fully focused, even during busy moments. It reinforced that acknowledging mistakes early protects patient safety and builds trust with both colleagues and supervisors. Since then, I've been much more deliberate about double-checking all patient information before recording or submitting anything. Question number 11. How do you communicate with patients' families during a crisis? This question evaluates your empathy, professionalism, and ability to provide clear information under stress. Families in crisis need reassurance, honesty, and compassion. So focus your answer on active listening, calm communication, and teamwork with the healthcare team. Demonstrate that you can balance emotional sensitivity with maintaining professionalism and protecting patient confidentiality. During a crisis, I make it a priority to communicate with families in a calm, compassionate, and honest manner. I start by actively listening to their concerns, maintaining eye contact, and using a reassuring tone. When sharing updates, I focus on providing information clearly and truthfully, avoiding medical jargon whenever possible. If the situation is evolving quickly, I keep families informed of next steps and ensure they know the care team is doing everything possible for their loved one. In one case, I supported a family during a cardiac arrest situation. My role was to answer their immediate questions while ensuring they stayed safe and informed outside the trauma bay. Afterward, I checked in to provide emotional support and connect them with pastoral care. I've learned that empathy, presence, and transparency help families feel supported, even in their most difficult moments. Before we continue, I just want to take a moment to thank you for watching this video. You can download a copy of these interview questions and answers in PDF format by clicking on the link below and supporting my channel by making a minimum donation of $3. Your support allows me to keep creating valuable content to help you pass your interview and land your dream job. Thanks for your support and appreciation. Question number 12. Explain how you educate patients or families about treatments or procedures. Interviewers ask this to gauge your communication skills, patience, and ability to translate complex information into understandable terms. Highlight your approach to patient education, how you assess comprehension, adapt to different learning styles, and confirm understanding. When educating patients and families, I always begin by assessing their level of understanding, health literacy, and emotional state. In the ER, people are often anxious or overwhelmed, so I make sure to speak slowly, use plain language, and break information into small, manageable parts. For example, when explaining discharge instructions after a laceration repair, I demonstrate wound care techniques step by step and have the patient repeat them back to confirm understanding. I also provide written materials for reference and encourage questions before they leave. If the situation involves medication, I review side effects and timing in simple terms, ensuring accuracy. My goal is to empower patients and families to participate confidently in their care. I've found that taking a few extra minutes to teach clearly can prevent unnecessary returns to the ER and build trust between patients and the healthcare team. Question number 13. What strategies do you use to prevent burnout in emergency nursing? This question assesses self-awareness and emotional resilience. ER nursing can be physically and emotionally draining, so interviewers want to know you have coping mechanisms to stay balanced. Highlight practical strategies, time management, teamwork, healthy habits, and reflection, and show you recognize the importance of mental health. I've learned that preventing burnout starts with balance, self-awareness, and teamwork. Working in the ER can be emotionally demanding, so I make a conscious effort to recharge outside of work through exercise, spending time with family, and setting boundaries between my professional and personal life. During shifts, I use brief mindfulness moments, deep breathing, or quick pauses to recenter myself after high-stress events. I also rely on my colleagues. We debrief after intense cases and check in on each other regularly. Having a supportive team makes all the difference. I remind myself often that you can't pour from an empty cup. Taking care of myself allows me to take better care of my patients. Maintaining gratitude and remembering the positive outcomes, even small ones, helps me stay motivated and grounded in why I became a nurse in the first place. Question number 14. Tell me about a time you went above and beyond for a patient. This question lets you showcase empathy, initiative, and patient advocacy. Choose a meaningful story that shows compassion and effort beyond your routine duties. Keep your example professional and focus on the positive outcome or the lesson learned. One evening, we admitted a homeless patient with severe dehydration and a chronic wound infection. While treating his medical condition, I noticed he was anxious about being discharged back to the street. After ensuring his immediate care was complete, I contacted our hospital's social worker to arrange temporary shelter and coordinated with a local outreach program for follow-up wound care. I also took extra time to explain his medication plan and helped him pack supplies before discharge. When he returned for a follow-up visit weeks later, he was doing much better and expressed gratitude for the help. That experience reminded me that nursing extends beyond physical treatment. It's about seeing the whole person and addressing the social factors that affect their health. Going the extra mile reaffirmed why I chose this profession, to make meaningful human connections even in the busiest environments. Question number 15. How do you verify accuracy in medication administration under pressure? This question gauges your attention to detail and adherence to safety protocols. Interviewers want to ensure that you maintain accuracy even during emergencies. Emphasize the 5 rights of medication administration and explain how you balance speed with caution. In the ER, speed and accuracy go hand in hand, especially with medication administration. I always follow the 5 rights: right patient, right medication, right dose, right route, and right time, no matter how urgent the situation feels. Before administering any drug, I verify patient identifiers, review allergies, and confirm orders directly with the provider if there's any uncertainty. For high alert medications, I request a double check from another nurse and ensure proper documentation immediately after administration. I've learned that even under intense pressure, taking those extra few seconds to verify saves time in the long run and prevents potential harm. I also stay familiar with medication protocols and updates so I can act confidently in critical moments. Safety is never negotiable. It's the foundation of trust between nurses and patients. Question number 16. What systems or EMR software do you have experience using? This question helps interviewers assess your technical skills and adaptability with digital documentation. If you've used specific electronic medical record EMR systems, name them and briefly describe how you use them. If you haven't, show your comfort with learning new software and your understanding of the importance of accurate documentation in emergency care. Emphasize attention to detail, speed, and confidentiality. I've worked extensively with Epic and Cerner EMR systems during my time in the emergency department. I use them daily to document patient assessments, enter physician orders, and record medication administration in real time. I've also utilized built-in triage modules to prioritize patients and generate reports for shift handovers. Accuracy and timeliness are critical in the ER, so I've developed habits like verifying patient identifiers before entering data and double-checking medication entries. I've also trained new nurses on charting best practices to improve efficiency and reduce errors. I enjoy using EMRS because they streamline communication between departments and make information easily accessible to the entire care team. While I'm confident using several systems, I adapt quickly to new technology and am always eager to learn any software your facility uses to maintain seamless patient care and accurate records. Question number 17. Describe your approach to triage and rapid assessment. This question measures your ability to prioritize patient care effectively, especially in the chaotic ER environment. Focus on your clinical judgment, ability to recognize critical symptoms quickly, and communication skills. If you lack direct triage experience, explain how you'd use assessment frameworks and teamwork to ensure safety and efficiency. My triage approach starts with a rapid but thorough assessment using the ABCS: airway, breathing, and circulation. I also evaluate mental status, pain level, and vital signs to determine acuity. I've learned to rely on both clinical judgment and standardized triage protocols, such as the Emergency Severity Index, ESI, to categorize patients accurately. In a high-volume ER, I stay calm and organized by constantly reassessing patients as conditions can change quickly. I also communicate closely with physicians and charge nurses to ensure critical patients are seen immediately. For instance, during a recent shift, I triaged multiple patients while recognizing early signs of sepsis in one, allowing for immediate intervention. Effective triage is about balancing efficiency with safety, making sure the right patient receives the right care at the right time. Question number 18. How do you stay current with advances in emergency medicine? This question shows your commitment to lifelong learning and professional development. Employers want nurses who keep their knowledge and certifications up to date. Mention how you stay informed through continuing education, workshops, certifications, or professional networks, and why it matters to your practice. I believe that staying current in emergency medicine is essential for providing the safest and most effective patient care. I regularly attend continuing education workshops and maintain certifications such as ACLS, PALS, and TNCC. I also subscribe to journals like Emergency Nursing World and participate in online webinars hosted by professional organizations such as ENA. At work, I learn through daily collaboration, discussing new treatment protocols with physicians, and participating in debriefs after critical cases. I make it a habit to review clinical updates from the CDC and American Heart Association, especially when new guidelines affect our protocols. I view education as part of my responsibility to patients, not just professional development. Staying informed allows me to adapt quickly, apply evidence-based practices, and ensure every patient receives the highest standard of emergency care. Question number 19. Tell me about a time you had to advocate for a patient. This behavioral question tests your ability to stand up for patients' needs, safety, or rights. Choose an example that demonstrates professionalism, courage, and compassion. Show that you prioritize patient well-being while maintaining respect for colleagues and protocols. One evening, I was caring for an elderly patient who had been triaged for discharge, but I noticed subtle changes in her breathing and skin color. Despite stable vitals, something didn't feel right. I rechecked her oxygen saturation, which had dropped slightly, and alerted the physician immediately. After further evaluation, we discovered early signs of pneumonia, and she was admitted for observation. My willingness to speak up likely prevented a serious complication. Advocating for her reminded me that nurses are the last line of defense for patient safety, and even small observations can make a big difference. Since then, I've always encouraged open communication within the team and made patient advocacy a core part of my practice. Question number 20. What would you do if a colleague was not following standard protocols? This question assesses your integrity and professionalism. Employers want to ensure you'll protect patient safety while handling conflict appropriately. Explain that you'd address the issue respectfully, follow chain of command, and prioritize safety without confrontation. If I noticed a colleague not following proper protocols, my first step would be to assess whether the situation poses an immediate risk to patient safety. If it did, I'd intervene immediately and correct it in the moment while maintaining professionalism. For non-urgent issues, I'd speak privately with the colleague to clarify the situation. Sometimes misunderstandings occur or new staff aren't familiar with updates. If the behavior continued or endangered patients, I'd escalate it to the charge nurse or supervisor as per policy. I believe accountability and teamwork are key to maintaining a safe environment. I've had to handle similar situations before, and by approaching them with respect and honesty, I was able to protect patients without creating unnecessary tension within the team. Question number 21. Describe a time you had to deal with an angry or uncooperative patient. This question evaluates your patience, empathy, and ability to de-escalate tense situations. The interviewer wants to know that you can handle conflict without taking it personally. Use a real or training-based example to show you stayed calm, listened actively, and prioritized patient safety. End your answer by reflecting on what the experience taught you about communication and compassion. I once cared for a patient who became extremely frustrated after waiting for test results. They began shouting and demanding to leave. Instead of reacting defensively, I calmly approached, maintained eye contact, and let them express their concerns fully. Once they felt heard, I explained the reason for the delay and reassured them that their test was being prioritized due to their symptoms. I also offered comfort measures, like a blanket and water, to ease their stress. Within minutes, their demeanor softened and they apologized for their reaction. The test results came soon after, and they thanked me for my patience. That situation reminded me that anger and patience usually comes from fear or frustration, not disrespect. Meeting them with empathy and calm communication can turn tension into trust. Question number 22. How do you manage emotional stress after a traumatic case? This question gauges your emotional intelligence and self-care habits. The interviewer wants to know that you have healthy coping mechanisms to handle the intensity of ER work. Emphasize balance, reflection, and teamwork, acknowledging the emotional toll without sounding overwhelmed. After a traumatic case, I give myself space to process the emotions rather than suppress them. I participate in debriefings with my team whenever possible. Talking through what happened helps us learn and heal collectively. I also reflect privately afterward, reminding myself that I did everything within my training and ability to help the patient. Outside of work, I manage stress through exercise, spending time with loved ones, and maintaining hobbies that recharge me emotionally. I've learned that caring for myself is essential if I want to keep caring effectively for others. It's never easy to witness tragedy, but having a supportive team and healthy coping habits allows me to maintain resilience and continue giving my best in every shift. Question number 23. What shift schedules or flexibility are you comfortable with? This question determines whether your availability matches the unit's needs. Be honest but flexible and show enthusiasm for teamwork and patient care. Emphasize reliability, adaptability, and understanding that ERS require coverage at all hours. I'm comfortable working a variety of shifts, including nights, weekends, and holidays, since I understand emergency departments operate 24/7. In my current role, I've worked rotating shifts and have learned how to manage my sleep schedule and energy effectively. I'm reliable about arriving early, giving proper handoffs, and supporting coworkers who might need coverage in urgent situations. I also appreciate the balance that comes from flexible scheduling because it helps distribute the workload fairly among staff. What matters most to me is contributing to a team that provides consistent, high-quality care regardless of the hour. I'm open to discussing any scheduling needs your department may have and confident I can adapt to meet them. Question number 24. What are your strengths and weaknesses as a nurse? This question helps employers assess your self-awareness and honesty. Choose strengths relevant to emergency nursing, like teamwork, communication, or adaptability, and pick a real weakness that you're actively improving. Avoid vague answers like, "I'm a perfectionist," unless you explain how you're managing it constructively. My biggest strengths are staying calm under pressure and communicating effectively with both patients and team members. In the ER, I've learned that a steady tone and clear instructions can prevent confusion during critical moments. I also pride myself on being adaptable. I can shift from trauma to pediatric care seamlessly while maintaining focus. As for a weakness, I used to struggle with overextending myself when the department was short-staffed. I've since learned the importance of setting limits, asking for help, and maintaining balance to prevent fatigue. Recognizing that teamwork is more sustainable than self-reliance has made me a stronger, more effective nurse. I'm continuously working on time management and delegation to support both my patients and my colleagues better. And finally, here's the last ER nurse interview question, question number 25. What questions do you have for us? This question gives you the chance to show interest and engagement. Ask thoughtful questions about training, teamwork, or expectations, not salary or scheduling. Prepare 3 to 4 questions that reflect curiosity about the hospital's culture and opportunities for growth. I really appreciate the opportunity to interview and would love to learn more about your team. Could you share what a typical day looks like for an ER nurse here and how the team collaborates during high-volume shifts? I'd also like to know how new nurses are supported during their transition period, whether through mentorship or ongoing education. Another question I have is how this hospital measures success for emergency nurses in the first 6 months. Lastly, how would you describe the culture of this department, particularly how teamwork and communication are encouraged? I value environments that foster collaboration and continuous learning, and I'd like to ensure I can contribute meaningfully to that culture from the start. If you want to learn more on how to land jobs and reach your career goals, don't forget to hit that subscribe and bell notification button to get new videos every single week. Also, don't forget to hit that like button because that motivates me to keep doing what I do. Stay safe, keep smiling, and good luck.